Hi, everyone. I'm Kim Nye. I'm the founder and executive director of TESS Research Foundation, and I'm also the parent of two children with the genetic disorder. Time and again, the first conversations that I have with families new to our community revolve around genetic reports and figuring out what they can do next. Learning more about a possible genetic disorder can come with tons of mixed emotions and a lot of unfamiliar terms, but it's also a powerful piece of information that can help guide your next steps. We are joined today by Dr. Lauren Beretich, a genetic counselor who we hope will help families understand what a genetic report can tell us and maybe provide a jump start to charting their next steps. So let's get started. Welcome, Lauren.
Thank you for having me.
Absolutely. For someone who's never had genetic testing, how would you describe what it is and why a person might need it?
That's a great question. Genetic testing is a broad term, and it's used to describe different ways to analyze our genetic information or our DNA to better understand if it's typical or atypical. And like you shared, someone may choose to have genetic testing to better understand the cause of their symptoms or to confirm a diagnosis. A diagnosis, of course, can be extremely useful um, to, again, understand the risk for family members, provide a targeted prognosis or management strategy, and guide potential treatment or clinical trial involvement.
Okay, so let's jump into what a genetic report tells us. What are some of the important terms that a patient or parent or loved one will need to understand?
Yeah, there's a lot of pieces. And I want folks to keep in mind that every genetic test is unique. So the report that you may have received from your doctor or healthcare professional may look different from your neighbors. Often, to make a diagnosis, healthcare professionals could order a genetic panel looking at a handful or a cluster of genes. You may also have had whole exome sequencing that just looks at the exons or the coding regions, or whole genome sequencing that looks at both the coding and the non coding region. So, the type of genetic test, as well as the clinical genetics laboratory running that test, both of those are going to impact exactly what your report will look like. Also, a lot of folks are not aware that the doctor or healthcare professional that's ordering your genetic test is not the same one in the lab that's processing a sample or interpreting that sequence data. So, generally, this is done in a clinical genetics laboratory, which could be at your academic medical center or farther away. So, there are many professionals who are involved from sample collection to results disclosure. And that's one reason we'll talk a little bit about this later that it's normal for your healthcare professional to need to talk to the genetics laboratory or another professional to learn even more information about your specific result. Now, let me pull up a slide that may help us talk through this information. So, here we have a mock genetic testing report summary. So, for anyone who's had genetic testing, you know this is just high level information, and that in your actual report, it's going to include more information not only about your specific result, but about the test methodology and potential limitations of this genetic test. But I want to go over this from left to right, knowing that these key categories are likely very similar to a result that you may have received. So starting here to the left is the gene. So this is just going to tell us where they found a particular variant in what gene. And in this case, it's BBS1. The next column here is the variant. And some folks are not as familiar with this term because we use a lot of terms to refer to the exact same thing. You may have heard the term mutation or genetic change. These are really referring to the same thing. What is the specific change within the specific gene that has been identified by the lab? So it's absolutely okay to use whatever term that you're familiar with or most comfortable with. But in terms of clinical genetics and genomics, variant is the most preferred term because it doesn't assume pathogenicity, which we'll talk about a little bit later. So it's really the exact coordinates of that genetic change that you can see listed here. The next column is inheritance. And this information is helpful because it tells us, one, how many copies of a variant are required to cause this condition or the disease. And in this case, for an autosomal recessive condition, this tells us that not one, but two variants are required for someone to present with this condition. The next column is the condition itself, and it's telling us what condition is associated with the genetic change or the variant that was identified. In this case, Bardet-Biedl syndrome 1. Now, the next column here is zygosity. Zygosity is important information because it indicates whether an individual has one or two copies of the specific genetic variant. In this case, homozygous tells us that there are two copies of the variant present or that both alleles are the same. If you would see the term heterozygous, that would tell us that there's one copy of the variant and that each allele is different. Last but certainly not least is the variant classification. In this case, pathogenic. Now, a variant classification is how a laboratory tells us if this variant is anticipated to cause disease or not. So I want to dive into that a little bit. So this is the variant classification scheme that was recommended in 2015 by the American College of Medical Genetics and Genomics, as well as the Association for Molecular Pathology. And you can see 5 tiers ranging from benign in the dark green to pathogenic in the brick red. What's important in a clinical stance is that the benign and likely benign variants are not anticipated to cause disease, and very rarely will these come up or be reported on a clinical genetic testing report. Now, you can see on the opposite end, likely pathogenic or pathogenic variants are anticipated to cause disease, and these are generally what we would consider a positive genetic testing result, of course, considering the inheritance of the condition as well. You can see here right in the middle are variants of uncertain significance. And this tells us that there's not sufficient evidence to determine if this variant causes disease or does not. And generally, these are not used for clinical or medical decision making for that reason. You can see the arrows below. Generally, as we have more evidence, that's beneficial to better understand what category or classification this variant should fall into. So I've thrown a lot of information at you all, but I want to come back to this report summary that we were talking about. This is what we would consider a positive genetic testing result because you see here that the variant is considered pathogenic. There are 2 copies of this variant, and that's consistent with what we would see for an autosomal recessive condition. But it's important to keep in mind that results can also be negative. For example, if we did not identify any genetic changes, or inconclusive. For example, if a variant of uncertain significance was identified.
I was going to say that visual was super helpful. Thank you so much for sharing it.
Absolutely.
In terms of, you talked about what a genetic report looks like and what it can and can't do, but how can those genetic results affect family members or family planning?
Absolutely. So this is important to consider because most genetic conditions are either inherited or can be passed on to future generations. So something important to keep in mind is the inheritance pattern that we had discussed previously, which most common are autosomal dominant, autosomal recessive, or X-linked. Well, that's not an exhaustive list. So this information can help us understand who else in the family might consider genetic testing because they too could have the condition or disease, or they may have a higher risk of passing that on to the next generation. And even for an individual or a family, this can also guide family planning options. There's a number of genetic testing options during a pregnancy or even preconception on embryos that are available for many families to better understand, again, the risks for a future pregnancy or child. Um, and just on that note, anytime we're dealing with families, those conversations can be, quite difficult. This information is new for families. And so I always encourage folks to talk with their healthcare professional or a genetic counselor to receive some type of family letter or just guidance on how to have those conversations if folks are reaching out.
Absolutely. I'm a big fan of genetic counselors, so thank you for the work you do.
Yeah.
Why does a specific gene variant, or it could be referred to as a mutation, why does that matter in terms of potential treatment options?
So that information is so critical. And in terms of treatment or clinical trial involvement, sometimes just having a diagnosis or confirming that molecularly is enough. But in other cases, it's really not. So it's important to know specifically what is that mutation or the genetic coordinates, the variant that we've been talking about. And we want to know what that variant is because we want to ensure that the therapy is designed in a way that it matches how this variant is acting within the body, because ultimately we want to help and not further harm an individual. And so that's why it can be extremely critical just based on how these therapies are designed. Some folks will hear terms like gain of function or loss of function. And gain of function, for example, can tell us that the gene product ultimately is overactive or acts abnormally, whereas loss of function can tell us that the gene product is underactive or missing. And all of that is just important to, again, assure that the therapy design matches the specific variant of that individual so that we're seeing maximum clinical benefit. But another reason to be in close communication with your healthcare professional about treatment options or investigational treatments. Clinicaltrials.gov is another fantastic resource, and getting involved with patient advocacy groups. They are usually the first to know about investigational therapies. And on that note, Kim, I'm curious from your perspective, can you tell us more about how patient advocacy groups or foundations like yours help families who are newly diagnosed?
Yeah, absolutely. Having a genetic diagnosis, it's not the end. That's the main thing I tell families is that this is not the end of your journey. This is a powerful piece of information that can help guide next steps. We're going to put some links to resources on the webpage along with this presentation. But I did want to just mention some of those resources. So there is an organization called NORD for rare diseases, and they have some NORD reports. And if you search the gene name or the name of the disorder, you'll often find a NORD report, and that can lead to an overview of the disorder, but also nonprofit organizations and other resources that can help you from there. There's also clinicaltrials.gov that you mentioned, Lauren, for potential treatments on the horizon for the disorder, and certainly finding a patient advocacy group that is specifically dedicated for the new diagnosis or an umbrella group that might be able to say, hey, we have shared symptoms, but here's a good next step for this more specific diagnosis. For families that remain undiagnosed, there are still resources. So my family had a 10-year diagnostic odyssey, and sometimes that can feel lonely. But there are organizations like the Undiagnosed Disease Network that can really help you with the next steps, even if you don't have a diagnosis, and certainly talking to your clinician about additional tests or having your genetic results reanalyzed at a later date because these things are constantly being updated. Those are really useful things for families in the undiagnosed disease pool. Um, I wanted to throw it back to you before we close. Is there anything else that we didn't get to discuss in this conversation?
No, I think you made some great points, is that obviously those next steps are going to vary based on what that report is telling us, if it's positive, negative, or somewhere in between. And I always want to be clear that no one genetic test can test for every genetic condition or disease out there. So, based on your results, especially if they're negative, it's possible that your healthcare professional will give you the option or recommend additional or more comprehensive genetic testing. And again, if you have any questions, always ensure to ask your healthcare professional. And if you are in need of additional information, I always encourage folks to talk with a clinical genetics professional like a genetic counselor. Findageneticcounselor.com is an easy way to find someone in your area if those folks are not readily available to you.
Fantastic. Thanks so much for all those resources, Dr. Beretich.
Thank you for your time. Have a great day.
You too.